Hello, this is Bill Bird, Chief Medical Officer at CGH Medical Center. And this is Dr. Ian Baer. Dr. Baer is a general and endocrine surgeon here at CGH Medical Center. And we're in one of our OR rooms, and we're doing a little field trip. And the purpose of this field trip is to give you all that are watching this just a little taste of the Da Vinci robotic system that Dr. Baer and several of our other surgeons use here at CGH. Thought that would be helpful for you to get a sense of what it's capable of doing, how it works, to kind of take some of the demystifying it a bit, if you will. So Dr. Baer is going to be running this show though. So Dr. Baer, are you ready to give us a tour of all things Da Vinci?
Yeah. I mean, I guess to start, Da Vinci is meant for minimally invasive surgery. Minimally invasive surgery has been around for several years. Traditionally, minimally invasive surgery is done through small instruments like this, about the size of your pinky, and they go inside of a patient's belly.
So it's going to blow up the belly.
Yep.
Trocar goes in.
Yep, like a straw, essentially inside of the belly for air and instruments to go through. A traditional laparoscopic is what they call traditional minimally invasive, will go through this straw and into a patient's belly or wherever a surgeon's working. One of the key differences between this instrument is that at the end it doesn't what we call articulate. It doesn't bend like your wrist. And so the capabilities of this are a little bit limited.
Yeah, I don't know if you can see that from the camera, but if you could open that up again. So it has like a pinching type of motion, but it doesn't do any of this. It just is rigid. Yep, okay.
And then I'll grab one of our newer robotic instruments. So this is for the Da Vinci, and you notice that this instrument will bend. It can rotate 360 degrees in addition to opening up. And so, some of the key differences in terms of what this will allow us to do is one of the big advantages in what we call suturing, to be able to sew different things together inside of the belly. A significant advantage with this instrument. The other is where you can go inside of the body. For instance, if you're going down into the pelvis, because of the bones.
That's kind of like from here on down, kind of in that area, if you will, right?
Yeah, and because of the bones, it limits that space. You can't fill things up with air and make it bigger.
Okay.
But so with arms that can articulate and bend, you can do a lot more in places that are normally difficult to get to in a minimally invasive fashion.
Yeah. I know, for instance, I've heard you say this, and I've talked to him too, that like Dr. Kim, who's a colorectal surgeon here, does some of those colorectal cases, and having that to be around the rectum in that area is very helpful.
Yeah, no, absolutely. So traditional surgery for colorectal surgery, for example, was done through a big incision. People would be in the hospital for several days to even a week plus to recover from that. And these days, people are going home within a few days sometimes. For a lot of surgeries, people go home the same day, which is the advantage of minimally invasive surgery. Another operation that Dr. Steve Kim does here are called hiatal hernias. When your stomach goes up into your chest cavity, he's able to do that in a minimally invasive fashion with our robots.
Yeah.
Where traditionally that would be through a big incision in your belly to fix something like that.
And also it's gone from doing it with the rigid scopes or the rigid kind of thing to now with this Da Vinci, that hiatal hernia surgery, he can do much more, I'm sure, have much better ability to get to the field and make.
Yeah, I mean, with these instruments and cameras, you can go way up from our belly into someone's chest to see things that are going up into the chest cavity and put them back into the belly where they're supposed to be. So a very big advantage in where you can go in the body.
Yeah. Besides hiatal hernia and then pelvic floor surgeries, what are some of the other surgeries that like you do with a Da Vinci, and maybe, I don't know, some of our other surgeons, how they're using it too, just so we get folks who are watching get a sense of that.
Yeah, so a very common surgery throughout the country and in the world are hernia operations. Hernias are a hole essentially in the muscle where abdominal contents can move up and into them and cause pain. Heaven forbid, an intestine gets stuck and it becomes an emergency. Are fixed in a minimally invasive fashion, I'd say 95% plus of the time these days. And I do almost all of my hernia repairs these days robotically.
Okay.
And one of the big advantages of why is we typically fix a hernia with a piece of mesh. Think of it like the screen in a window to make it a stronger repair. And to sew that mesh in place, we can do much easier with the Da Vinci robot. And what we found is that hernias come back less often the more space is covered by mesh. So if a small hole is fixed with a bigger piece of mesh, the likelihood of it coming back is much less. And with a traditional laparoscopic technique, we used to use what are called tacking devices, where you put tacks or essentially a small little nail into the mesh and into
Sounds
papers.
nice.
Well, it could be uncomfortable for patients to have that done. While successful, it is less painful having it sewed robotically. So less pain with a robotic assisted approach is definitely an advantage. So hernia surgery is something we do. Gallbladder surgery is something done robotically these days. There's actually a technology where they can make part of your digestive tract, what's called your bile duct, light up fluorescently. So there is a medicine you give a patient before surgery, and that goes into their body. And we can use our robotic camera, and we'll show you in a little bit our robotic screen to look at that anatomy and find it to light up fluorescently. So normally if it's covered by fatty tissues inside the body, things can hide. Our anatomy is not always 100% right there. And so to more safely identify things, that's also an advantage of the Vinci robot, not just for gallbladder surgery, but for our urologists. They can make our ureters, or the pipe that goes from the kidney to the bladder, light up fluorescently, which is a real big advantage because normally that is a small, think of it, little pipe or essentially a little worm that hides in the belly cavity, and it's not always easy to find.
Sure.
And that's an advantage of the Da Vinci robots and fluorescent technology.
Okay. I hope you get a sense that there's a lot of things that this contraption behind us can do for patients that traditional surgical techniques couldn't do. So with that being said, let's get actually looking at can you kind of explain what we're seeing over here? Dr. Baer, talk us through what we're seeing here and how this robotic Da Vinci machine works.
Yeah, so this is, I would say, one of 4 components of what you need for doing robotic surgery. And these are the working arms of our Da Vinci robot. There are 4 arms, and these can move. They can go up, they can go down. And we attach, essentially if you want to think of it as like a straw, okay, we attach these to the robot once it's inside a patient. So this will get attached to the robot here, okay? And once these are in place, these arms will move from our robotic console, which I'm going to show you in a minute.
Okay.
Another part is the robotic instruments, which will go through these. And so you can see this will fit through this straw and down and into the patient. Okay, and these instruments are used by the surgeon, which is another part of the equation. And I control the console, which I'll show you guys here in a second. And that is essentially a 4-dimensional view using a robotic camera, which will also attach to one of these arms.
Okay.
So these arms have instruments and a camera attached to them and move inside of a patient, controlled purely by the surgeon. And when you think of a robot, this is not a robot doing your surgery. Okay, these are surgeons who are doing these operations, controlling the robot. So that's an important thing
That is a distinction that's important that you make. Yes.
There are many robots these days like that vacuum your house. Okay.
Yeah.
That are doing the vacuuming. You are still having a surgeon do your operation.
All right. Yeah. Very good. So all these different arms have stuff that's attached to them.
Each arm will have something different attached to it, whether it's a suturing device, whether it's a camera, whether it's a stapling device. There are a lot of different instruments we can use during an operation, all attached to these different arms.
Okay. Anything else we need to know about this area right here?
Not that I can think of.
Okay, great.
Yeah.
So I tell you what, why don't we go over to, what was the other piece we need to look at now?
The console.
Okay, so let's go over and we're going to take a look at the console, and Dr. Bear is going to walk you through what that's all about too. Okay, so here we are at the console. Mm-hmm. All right, I'm going to hand it over again to Dr. Bear to walk you all through what exactly is happening here as he does the procedure at this console. So Dr. Bear?
Yeah, so we actually have 2 consoles here at CGH Hospital, which is a pretty cool thing, so that you can have 2 surgeons helping you at the same time. They're also very educational for our staff who are often learning here at the hospital. But so if you want to think of this as a virtual reality headset, if anyone's ever put one on, you will put your head, as I'm going to do right now, into this area. Okay, and as I'm looking, you can hear the speakers.
Yeah, that's cool. Yeah.
The speakers go through this to the robot so that the staff can hear what I'm saying while I'm looking through these eyepieces. These will give me a 3D view through a robotic camera to see what the robot's arms are looking at. There are 2 little joysticks here that I will use with my hands to control the robotic instruments. You can only control 2 of them at a time. And we'll show you in a little bit, there are some foot pedals down here. So while I'm using my hands, I'm also using my feet. And I'm going to press various pedals to move the camera, to switch between robotic arms. I can increase how much, for instance, heat. We use heat sometimes to cauterize blood vessels and seal them shut. So there's a lot of different things that we can do with our foot pedals here. Another neat little thing I can show you is my phone has a phone charger. This is a new feature for the robot, but that's actually something important as a surgeon is I don't have to carry a pager anymore. All of my pages come through my phone. So having it right next to me during surgery is actually really important. So that way people can get hold of me while I'm on call in case there are emergencies happening at the hospital. But so that's kind of what we use the console for, is to control all of our arms, to see what we're doing. Yeah. I'm not sure if we can maybe put up a video to see from the Da Vinci's website. We don't have a patient in here right now, but there are some pretty amazing videos you can even look up on YouTube to see what kind of surgery you're having, what your surgeon will be looking at and doing for your operation.
You know, I don't know, and when you'll see the pictures of what Dr. Bear is describing here, but as I look at all these moving parts, and I think about the moving parts of the arms that we just looked at too, it'd take a little time to get a handle on how to go about doing this. What was the training process like for you to get where you felt like you were really had this down? Because I know you've done a lot of Da Vinci work.
Yeah, so I was fortunate to be in training in my general surgery residency, where we had lots of surgeons using and teaching us how to do robotic operations. In order to be a robotic certified surgeon, you have to have performed a certain number of operations under the guidance of another surgeon. You have to show a certain amount of knowledge. There's a test that you have to take to show that you know how to use the different instruments, the different technologies. And once you've been checked off on those 2 things, then you are a certified robotic surgeon, and you will be able to do those operations robotically. I myself have done several hundred operations in training. I did well over 100 robotic surgeries of various types. These days, I think surgeons have to do, I believe, at least 30 operations robotically before they're certified. Obviously, it's going to change from state to state and institution. But,
yeah. I just I'm struck by the fact that this isn't something you would just like pop, you jump on a horse and start riding. I mean, there's some work involved with getting this where you're feeling good about it.
Yeah, even as a surgeon, yeah, for surgeons who've never done robotic surgery, there is a learning curve. And there are some surgeons who like doing robotic cases more than others, and that's a preference thing.
Yeah.
There are still many good operations that happen in a traditional, what I call laparoscopic fashion. There are many good operations that happen in a traditional open fashion. There are some cases that can't be done robotically, and that is okay.
Yeah.
But I do think there are many advantages to the system.
Yeah.
And for instance, if I was going to have a hernia fix these days, I would hope the surgeon's doing it robotically.
Yeah.
But that's at least my preference.
Yeah, very good. Well, hey, Dr. Bear, thank you so much for your time.
Yeah.
Thank you for those of you who had a chance to watch what we were showing you today. Encourage you to look up Dr. Bear and our other surgeons here at CGH who do robotic surgery, because I think it can be very helpful in the right situation for patients to have a really good outcome. And we're really happy to have Dr. Bear as well as robotic surgery here at CGH. So until next time, thanks for taking the time to watch our little field trip, and we'll see you soon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center, and Dr. Ian Bear, General Surgeon, Endocrine Surgeon here at CGH as well.